Hello friends, this video is about peptic ulcer. Definition: Peptic ulcer refers to an ulcer in the lower esophagus, stomach or duodenum, in the jejunum after surgical anastomosis to stomach and in ileum adjacent to a Medikal diverticulum. Etiopathogenesis: Heredity. Acid pepsin versus mucosal resistance. Cause of peptic ulceration is digestion of the mucosa with acid plus pepsin of gastric juice. Gastric hypersecretion is more important in etiology of duodenal ulcer. Other risk factors include smoking and alcohol consumption. Clinical features: it is chronic condition with natural history relapse and reemission lasting for decade, even lifelong. The most common presentation is that of recurrent abdominal pain, which has three notable characters: localization to epigastrium, relation to food, periodicity. Epigastric pain burning in character. Hunger pain, night pain are other features. Complication: upper gastrointestinal bleeding, perforation, gastric outlet obstruction, gastric malignancy, pancreatitis. Investigations: double contrast barium meal may show ulcer as greater or as deformed duodenal cap. Endoscopy can visualize the ulcer. A biopsy can be taken from gastric ulcer to rule out malignancy and Helicobacter pylori infection. Test for Helicobacter pylori. On endoscopic biopsy, rapid urease test, histology and culture. Non-invasive serology for IgG, urea breath test, Helicobacter pylori stool antigen test, serum gastrin and gastric acid analysis. Treatment: short-term management. General care: avoid smoking, avoid aspirin and NSAID drugs. Alcohol to be moderated. No spicy dietary advice. Antacid mainly prescribed for symptomatic relief. Sodium bicarbonate is the quickest acting antacid. Histamine H2 receptors antagonists include cimetidine, ranitidine, famotidine and nizatidine. Mechanism of action is inhibition of acid and pepsin secretion by blocking H2 receptor. Ranitidine 150 mg twice a day, cimetidine 400 mg twice a day. Duration for treatment: duodenal ulcer is 4 weeks and in gastric ulcer 6 to 8 weeks. Proton pump inhibitors. These includes omeprazole, lisinoprazole, pantoprazole and esomeprazole. Mechanism of action is irreversible inhibition of acid secretion by the proton pump. Omeprazole 20 mg daily for 4 to 8 weeks. Indication: reflux esophagitis and GERD. Peptic ulcer unresponsive to other medical measures. Zollinger-Ellison syndrome. Prostaglandin includes misoprostol 200 microgram 4 times daily, useful in preventing NSAIDs induced mucosal injury. Colloidal bismuth substrate. Sucralfate 2 gram twice a day. Carbizonol sodium. Treatment of Helicobacter pylori. Triple therapy: omaze, claromycin, metronidazole. Long-term management: intermittent treatment for symptomatic relapse, maintenance treatment, surgical treatment. For gastric ulcer, partial gastrectomy with Billroth's 1 anastomosis. For duodenal ulcer, selective vagotomy with pyloroplasty.